In this video, we're going to talk about how to sign up for healthcare in France as a resident, and because this will take some time, what to expect if you need medical care before you're in the national system.
Hi, I'm Raina.
I'm Jason.
We're Baguette Bound.
Okay.
Strap in. Grab a cup of coffee.
Or a glass of wine, depending on what time you're watching.
This is France. Because there's going to be a lot of information in here, but we hope it's going to make a process that can feel daunting when you get here easier.
Yeah. So, preparing for this process starts before you leave for France.
Yes, you are going to need to bring specific documents with you, birth certificates, marriage certificates, but most importantly, any documents that show the paper trail between the name that's on your birth certificate and the name that is on your passport today. So this could even include adoption records, previous marriage and divorce certificates. Bring it all.
Documents like these that are official records issued by the state will also need to be apostilled. An apostille is a form of authentication to verify official government documents so that they can be used internationally by other governments. So you'll want to check online with your local or state government on how to get your specific documents apostilled. It's going to be different depending on which state you're in.
Yeah, literally state to state.
So this is not impossible, but this is going to be a lot more difficult to do all this with these specific documents once you're here in France. So do the apostille process before you get on the plane.
Yeah. So once you arrive in France with your trove of documents, you are probably going to be landing in one of three situations: employed, self-employed, or not working, maybe on a long stay visitor visa or on a student visa.
Okay, so scenario one, if you're coming to France as an employee, you're going to be eligible for national health care immediately. Your employer will kick off this process.
Yay!
And in this case, you may not need to do anything. Yay! As your employer has the ability to register you in the French social system. But obviously, you'll want to talk with your employer to make sure that they're moving the ball ahead.
Right. So scenario two, if you are coming to France, as was my case, as a self-employed person, as soon as you register your business here in France, it's going to kick off a process to add you into the French social system all on its own. And then you'll begin making your social contributions out of your business income. Soon after, you're going to receive a letter in the mail informing you of your newly created French Social Security number. And this is going to be your identifier number or account number for the next letter you're going to get inviting you to sign up for the French National Health Insurance. So this form that you're going to receive by mail, which hopefully we are showing you right now, is the S1106 form. And it is the form that you are going to complete and attach all of the documents that it asks for and return by mail to verify your identity and your residency and sign up for the national healthcare system.
We'll come back and cover all those documents in just a second. The third potential scenario is if you're on a long stay visitor visa. This is probably the most common French visa type for those who are retired. Now, in this case, you must initiate this process all on your own. You will not receive anything in the mail, any kind of notice from France letting you know that you are eligible to start this.
This is the biggest difference between this type and the other two.
It's on you.
Yeah.
You do become eligible to do this, to register for the French social system after 3 months of residency in France. Once you hit that 3-month window, you can get started. But how do you initiate this process? You start by going directly to the French health insurance website, amelie.fr, and you download the same form that Raina mentioned earlier.
Yeah.
You'll look for, in English, it's called the Request for Access to Health Insurance Rights on the website. And again, you can look for that form number. Print the form, fill it out, and you send it back by mail with all of the supporting documents requested on the form. They will all be listed on the form that you need to send in.
Yeah. So what kind of documents might you need? We want to talk about this so that you will know to start gathering these during your first 3 months in France. So first, it's going to be all those things you brought from the US and make copies. Do not send originals. Even if they ask for them, send copies. And then additionally, you're going to need things that will prove you have been living in France for the past 3 months. So along with a copy of your passport and a copy of your visa validation, and this is an important note, the visa validation is the PDF that you were emailed when you validated it online. Jason will show you this document in the video he made on validating your visa, if you're not sure what we're talking about. But this is not a copy of the sticker in your passport that you got initially leaving the US.
Right. You're also going to need to provide documentation that proves that you have been living in France for these 3 months and you've met that 3-month requirement. Examples of this proof might be a lease or a rental agreement, receipts from paying your rent. You might have consecutive utility bills. And while this does include internet, this will not work for a mobile phone bill. That won't show that you actually live somewhere. So not a mobile phone bill. But you can do rental insurance bills. You can use consecutive hotel bills if you've been staying at a hotel. If you're staying with an individual in a private home, they can even fill out a signed statement documenting who you are, when you arrived, how long you've been, and where they're at to show that you've been living here.
Right. So at this point, you've got identity documents and proof of residency documents. And then you're also going to need a European bank account with an IBAN number. All EU, United Kingdom, and Swiss domiciled banks will have IBAN numbers, which are similar to what we think of as routing numbers in the US, but they are not the same thing. They are different systems. So you cannot use your US bank account for this. This is important because this bank account is going to be linked to your health insurance policy, and that's how you're going to receive your insurance reimbursements from the National French Insurance.
Extremely convenient, but you got to set it up in advance.
Right.
Now, all of these documents must be in French. We are in France. So even if you used English copies of some of these documents for your initial visa application,
Very
which is
common.
usually fine
Yep.
when you're doing this in the US, but these documents in English will get rejected during this healthcare application if they are still in English. So these translations must also be done by a French court-appointed translator. They'll be able to put their official stamp on these documents. You can look these up online. They're actually very easy to find.
Right.
We've added the website for the translation service that we used when we did it, but you can also just search for anyone. You can download that resource down below, down in the description.
Yeah. Now, okay, so you have filled out the form. You have gathered the documents and sent them back. Again, remember to send copies, not originals. And then you're just going to send it off from the post and wait. This could take a while.
It might, yeah. Now, one note, this entire process has to be done for each adult person separately. There is no family registration plan. There's no family form.
Put them in separate envelopes when you mail them.
Yes, these are separate, completely separate documents. Separate support must be sent. Now, we will talk about how to add your children to your plan a little bit later.
Right. Now, it is not uncommon to get letters asking for additional documentation during the process. Sometimes, often, documents that you may have already sent. Don't ask questions. Just send it again. I don't know what happens to them, but we sent my birth certificate, no joke, 3 times.
Yeah, and here you can help yourself. You can do yourself a favor. Make a copy of all the documents that you're putting in the packet to send in the mail, along with a short note to remind yourself what you sent, when you sent it, and where you mailed it to. This little information packet can be a really valuable clue if you do get a letter back in the future asking you for additional information to be returned.
Yeah, you might realize, oh, I didn't send the right thing.
It may be the case that a lot of time has passed and you forgot what exactly was in this document pack. But having copies of what you sent in on that first request it will help you. And this was how we were able to understand the initial rejection letter that I got when I applied. And the rejection was because we had sent a copy of my French visa sticker found in my passport, which is what I thought they wanted, when I should have been sending in the PDF document showing that I had validated my visa after arriving.
It has your Estrange number identifier,
a unique identifier
something,
number
so they want that.
For.
Okay, so after sending all the things as many times as they ask, maybe one day, 4 to 9 months later, you are going to walk to your mailbox one day and there's going to be a little green card in there. Congratulations. At this point, a Carte Vitale, I should say. At this point, you're going to be able to take that card with your number on it and you're going to log into the Amelie website, the French health insurance website, and you're going to set up your online account. So this is the point at which, if you have children, now that you are in the system, you can add them to your healthcare account. You are going to do this by downloading another form on the Amelie website. You can find it under the form section. It is going to be, you're going to filter for affiliation/registration, and you are going to look for document S3705A. The form is titled Request for Minor Children to be Attached to One or Both Insured Parents.
Now, your child will not get their own Carte Vitale. They will always be attached to the parents' cards and the parents' accounts. You'll have to add each child individually on the form, but you can use one form to add all of your kids.
Yep.
You will need to send in copies of documents like their birth certificate, the child's passport, proof of guardianship if that's applicable for you. You can use school records to show their residency, or you can use the same residency documents that you provided for your own application. And again, all of these documents need to be in French.
Right.
Now, the whole family is in the national system.
Yay!
And at this point, you can decide if you want to get a mutuelle policy. If you're not sure what a mutuelle policy means, you can watch our video on how the French healthcare system works. And now, you are all set up.
Woo! Welcome to the world of universal healthcare.
Yeah. And if you're saying, wait a minute, what about the health screening? There's no medical inspection by a doctor, no medical tests, no required listing of my pre-existing conditions. You're absolutely correct. We didn't forget.
Nope.
That's not a thing.
Not a
Here,
thing.
you sign up, you pay your social contributions, and you have health insurance. The end.
What a wonder.
It is,
Yeah.
Now, you may be asking, since this policy and this process could take months,
You should plan for it too.
it will take months.
Yeah.
It's not if it can, it will.
Yeah.
So what do I need to do if I need to see a doctor or fill a prescription while I'm waiting on the processing of these forms?
Right. So to start with, just like in the US, whether you have public or private insurance or none at all, none of that is required to see a doctor or fill a prescription. It just means you're going to have to pay for it yourself. Now, while that is a terrifying thought in the US, not so much here in France. Now, partially because it's supported by resident social contributions, seeing a doctor for non-urgent care is very affordable compared to the US. Most doctor visits here will cost between 25 and 100 euros. And everyone pays the same flat published rates for medications regardless of insurance coverage. So you can, if you're on a medication, you can figure out how much it costs, find these rates at this website, which hopefully we're showing you right now, and which I have added to the resource list if you have not downloaded it already. If you downloaded it a long time ago, I don't know if it's on there. But on this website, you can search for drug name, pathology, or active substance. So you can look up what medications are available and what the price is before you get here so that you can budget for that.
Yeah, very useful. And for hospitalization situations, which while still much cheaper than the US, can certainly still be expensive. However, the international healthcare policy that you are required to purchase for your visa application will likely cover those hospitalization situations.
That's really what they're for, is major medical.
It is, yeah. But the terms, conditions, and the specific coverages of those international healthcare policies can and will vary widely. So you're going to have to check your specific coverage to see what types of situations it will provide reimbursements and which situations you will likely have to pay for the full price on your own.
Yeah. Okay. Now, I know that was a lot.
Refill your coffee, pour another glass of wine.
Yeah. But we know you probably still have some specific questions because you've sent them to us via comments or email.
Yeah,
and
we've received so many great questions on this topic.
We wanted to just add some of those on here at the back end. So to start with, can you fill your U.S. prescriptions here in France?
You cannot, no.
No.
You will need a French doctor to write your prescriptions in order to fill them at a pharmacy here. So you can prepare for this by bringing a large supply of materials and supplies to kind of bridge that gap until you can get a prescription. Also bring paper copies of all of your prescriptions for 2 reasons. First, in case you get stopped at the airport going through security, like we did, and I had a suitcase full of a year's worth of diabetic supplies. I was able to pull out the prescription forms, and we kind of laughed and joked, and he sent me on my way. But the second reason is to just help your doctor and pharmacist find equivalent types of medications. Seeing it in writing may help them figure out what you need.
The French equivalent
The
here.
French equivalent, yeah.
Yeah.
Now, if you just heard that, the French equivalent, and are panicking, and now that you might not be able to get the same medications in France that you take in the US, now that's true. There is a small chance that this will be the case. Not every single medication that's approved for use in the US is also approved in France. This actually happened with the insulin that I was taking, but it really wasn't a problem because there's very similar medications available here. And I knew this beforehand because we actually found this on the website we referenced earlier. And on that site, I was able to find other types of comparable medications that were available. So I knew what to expect in advance.
Yeah. So another question, what if I can't find a doctor and get an appointment in time to fill my prescription before it runs out? So you can actually start looking for a doctor and make those new patient appointments before you even arrive in France.
Good idea.
Yeah. So you can do this by using the online websites, doctolib.fr, Maya, I think it's how you pronounce it, .com, where you can search by specialty, location, language is spoken for a doctor. You can also search for the local hospital in the area that you're going to and send them an email telling them you'll be moving to France, you're looking for a doctor taking new patients, and you'd like to get an appointment set up so that you know you're in the queue before you get here. And then after you arrive, if you haven't been able to do this yet and haven't found a doctor, you can also go to the local health center in your village, the Maison de Santé in your village. I guess I'm assuming everyone's moving to a village like us.
Good.
I don't know. Do they have those in the larger cities? Our French viewers will have to tell us. But they can help you locating a doctor who's taking new patients, or you can even talk to your local pharmacist. They are super helpful. And then if you are still really in a tight spot, you can even make an appointment with like an urgent care doctor. So you'll find those using the same websites that we referenced before. You're going to look for a médecin généraliste. Usually they will be based in like a hospital for urgent care. And you'll kind of, sometimes it's not obvious that this is the kind of doctor they are, but you can read the context clues. If they're accepting new patients and they've got a lot of appointments in the same week, that's probably what they're doing. So make an appointment with bring your prescriptions. They can usually kind of help you bridge.
Yeah, they won't be your long-term doctor, but they can help you right now.
Yeah,
So a common question, but what about Medicare? How is that going to help me?
Yeah.
Well, unfortunately, Medicare doesn't pay for medical services that you receive outside of the US, so it's not going to help you here.
Yeah.
However, one thing to note is Medicare Advantage plans. So if you have a Medicare Advantage plan, these often offer additional services, and they may cover medical costs that are incurred outside of the US. But again, you're going to have to check your specific policy because they can vary. So see what your Medicare Advantage plan offers.
Yeah. Okay.
Now, that was a
that
lot.
Was a lot.
If you're feeling overwhelmed by this healthcare process or anything in general with the move to France question, you can always book a one-on-one consultation with us, and we're happy to help you go through that.
Yeah. All right. Thanks for watching.
We'll see you soon.
A bientôt.